Hello, everyone. Welcome to Health 180 with Carrie and Fenn and Rogers TV and podcast. My name is Carrie and Fenn. By 2031, traumatic brain injury is expected to be among the most common neurological condition affecting Canadians. 1/3 of individuals with traumatic brain injury are women. The Indigenous community has a rate of 4 times higher than the rest of Canada. We want to help you learn more, so let's learn together. Dr. Ian Horseman joins me from the Brain Therapy Clinic. Dr. Horseman, welcome.
Thank you very much. I'm excited to be here.
Tell us about the work you do and how long have you been doing this?
Well, I've been a chiropractor for about 28 years. And then I started doing the brain work, and I've been focusing on neurological problems for about the last 10 years. Partly because I was actually injured myself. I had a pretty good car accident. And from there, I went out and learned how to basically help people with it. So that's where it came from.
Wow. Tell us, for those who may not know, what is a brain injury and how many types of brain injuries are there?
Well, a brain injury, there's basically 2 classifications. The first one would be a fairly severe traumatic brain injury, and that's where there's like a fracture of the skull or a major brain bleed or something. We don't deal with those here. They tend to go to the hospitals and require immediate medical intervention. And then the vast majority of them are TBIs, or traumatic brain injuries, and they're minor. Most of them, 80% of them, go away within the first 10 days. However, there's a few factors that affect whether or not you do get over that in that period of time. And one, as you mentioned, is being a female. It actually takes much longer for females to get over them than the standard 10 days.
What are some of the symptoms of brain injuries?
Well, the most common ones, and it's partly the way that we're designed, but one of the main things is balance issues tends to be one of the very first. Headaches, of course. Sensitivity to light or your sound or smell, so you get a lot more sensitivity. You can get emotional issues with it. You can have more anxiety and depression, of course, usually a bit later on. Then there's the cognitive issues, memory, short-term memory problems, troubles putting things in order, the higher brain function stuff as well. So
when does symptoms of a brain injury normally emerge?
Most of the time, if it's a significant brain injury, you'll notice things right away. So you'll notice within the first even 5 minutes, the person will often have an immediate headache. Their vision might be impaired. They might have trouble seeing something all of a sudden. Balance could be off. They could get nauseous. And then, of course, it progresses from there. So
we often hear about athletes and concussions, but concussions can actually happen to regular people. It does happen more often than we think. Is concussion considered a mild injury?
Yes, well, there's basically, back to the categorization, there's the mild traumatic brain injury, and then there's something called post-concussion syndrome, and there's acute and chronic. So when it doesn't resolve itself in the first 10 days, like 80% do, I'd say more like, honestly, 70% do, then it becomes a chronic post-concussion syndrome. And that means that it's not going away. The person's left with some level of deficit. And of course, the more deficit, the more issues the person has.
So when someone hit their head, from a slip and fall, playing sports, falling off a bike, or a car accident, what is the first thing should one do?
Well, the first thing you should do is do an assessment of where you are, because obviously it's a safety thing. If you're driving a car, you should probably stop driving, pull over, make sure that you can still see properly, that your vision is correct, your balance is okay. Typically sit down, maybe drink some water, and just sort of give yourself a reset time. If it doesn't reset, and you still feel lousy, then you should probably call for some help.
How do you determine the severity of a brain injury?
Well, we have a number of different ways. And the way we look at it is what's impaired. So if, let's say, for instance, your vision, we have machines that we can actually, one's called a VNG, and it's goggles that measure your vision. And we want to see that you can move your eyes properly together as a team, okay? You can also look at something called a QEEG, which is a scan of your brain. And you can see what parts of your brain are working, what's not working, what's too active and underactive, how much of your brain is involved in that. And you can tell a lot from the symptoms, because your symptoms basically tell you what's not working well.
How specifically, when you meet your patients for the first time, tell me about that first experience.
Well, what we try to do is we first have a wonderful online questionnaire that helps people to go through and decide whether or not they have a concussion. So we have a question and answer, and it also helps to rate it. Once they come into the clinic, we run them through a very thorough evaluation. We ask them all the questions. How did it happen? And then we run them through a number of different tests. We look at primarily first start with usually balance and proprioception, how they can feel. We look at their eye movements. We look at a number of different things, and depending on, of course, how they react and what they're telling us. If their main problem is a headache, then we'll also look at the base of their neck, their skull, because that can also be involved. So depending on what you come in with, your symptoms, that helps to determine the evaluation process. As soon as you come in, then it's very simple. With the brain, we say, okay, if this isn't working, let's say your balance isn't working, we'll give you some treatments the first day and see if your balance improves. And if it does, then we give you that to do at home. Because everything is so that you can get over this as fast as possible, and also as complete as possible, so you don't have any long-term effects from it.
Give us a couple things that you do with regards to helping with the balance.
Sure. So one of my favorites is something called the Caloric. Now, for those people who've had one out there in medicine, what they do is they put warm and cold water in urine. They blast it at a very high rate. We don't do that at our clinic. It's very simple. We put very gentle warm water in one of your ears. And what it does is it causes your brain to think you're moving. But what it really does is it resets your center point back to normal. And that gives you the ability to walk properly, look at things and that. So you put some warm water in the ear towards the side that you fall towards. So if I fall to the right, I would put the warm water in my right ear. If I fall forward, I would put the person's head slightly back into the right. Or if they fall backwards, I would put their head forward and put it in their ear. The great thing is they stand up, and within almost instantly, they feel different, they feel better, they feel more secure. And also that might last up to 2 weeks just by doing one of them. And then we teach them things they can do to mimic that at home as well.
Why do you think traumatic brain injuries are so common in Canada?
Well, one of the big ones is, and I'm glad you mentioned it, is car accidents. There's a lot of people that have injuries from car accidents that are misdiagnosed or not diagnosed at all. Many people have had falls and traumas in their lifetime. And again, they tend to be somewhat accumulative. If you don't get it fixed properly, what you did last time can be added onto this time. And that's one of the things that we're constantly doing research on to figure out, well, why is that? And what can we do to hopefully stop that from continuing on? So as far as Canada goes, we play a lot of sports. We're a very active people. And I think that's when you do a lot of contact sports, our number one sport here, of course, is hockey, and that's got a very high level. Another sport for females is lacrosse and also soccer. So those things that we tend to do tend to drive more accidents. And then, of course, we live in the land of ice. So there's a lot of slip and falls here that don't happen in other countries. So I would say that that's another factor as well.
There are stigmas associated with different medical conditions. If someone has a brain injury, does that mean that you can't make decisions for yourself?
So the stigma for all mental health is the same. I can't see it on you, therefore it's all in your head. We hear that all the time. And of course, what we do is we test the person's brain. We say, yes, it is in your head. It's in your right frontal lobe. So it's kind of a little joke. But the thing is that people who don't understand it, who've never had one, they often will say, oh, you should be better. You should just get over this. The people that are suffering from it, like anxiety or depression, will tell you it can be very devastating. So patients' ability to make decisions, of course, are impaired with cognitive function. But I would suggest that the brain has this wonderful ability, and it's called plasticity. And this was discovered not long ago. The brain has the ability to rewire itself. So even though you're injured, it will often pick up areas around it that can help you to do that. So we try to get those areas working better, and then you can make better decisions. Most of the things that are a result of an injury will improve with time.
Are all patients with brain injuries the same?
No, there's variations of it. Now, there's a few things that we should factor in there. Age is one of them. The younger you are, the more your brain uses up energy, the more metabolic it is. So younger people have more troubles getting over it. Females are much more difficult to heal over a brain injury than men. Female brains, as you know, are much more complicated. They're much more connected. And so because of all those extra pathways, when you take one system down, you can affect many, many different things. When male brains are much more simple, I can speak from experience. What happens is that our brains are not as complex. Therefore, and that's one reason when they do anxiety and depression studies, research for the medications, they use men brains because it's easier to detect it when there's a problem with that system. So that's a big factor. And then of course, the severity of it. Have you had them before? If they've had a couple before, then you might just do something very small and it can set you off. Here's one of the things that we're just running into. It's happened to me 3 times this week. You know, the test to see whether or not you have COVID. Well, what they're doing is they're sticking up that Q-tip way up in your sinuses. And I've actually had 3 patients have a concussion from that because they had previous injuries before, and that actually set them off.
Wow.
Yes, never thought of that. It's just starting to happen now. So I'm going to start spreading the word on that. Maybe just keeping it in the lower part of your nasal passage so that it's not going up too far.
Too far. What's one advice you can give to a patient going through a brain injury regarding coping through this process?
Well, first off, a brain injury, I always explain it. It's like, if you've never had one, I like to explain it like this. It's like having a supply school teacher running your brain. I mean, what happens is that, you're still able to do a lot of the things, but it's just not the same, right? When you have a supply teacher, what happens? Well, the students act up, they don't behave properly, they don't get their work done. And it's the same idea. I like to explain it like you have a supply teacher. So even though you can do some of the things, it's that some of those things that are normally kept in check, like for instance, your sensitivity to sound or sight or smells, they go off the charts because normally your school teacher would say, shh, quiet, we don't have to listen to that. Your pain levels jump up. And then of course, with all of that, you have a lot more anxiety and frustration and fear. And then with time, it can lead to depression. So there's so much to it. So
much to it. And you have to be careful and, do what you need to do. This is Health 180 with Carrie and Fenn and Rogers CVM podcast. My name is Carrie and Fenn, and we are exploring brain injury with Dr. Ian Horseman from the Brain Therapy Clinic. We will be right back. Welcome back to Health 180 with Carrie and Fenn and Rogers TVN podcast. My name is Carrie and Fenn. We are exploring brain injury with Dr. Ian Horseman at the Brain Therapy Clinic, talking about what you should know if you or a loved one is impacted by a brain injury. Let's go on site with Dr. Horseman to learn about some of the techniques he uses to treat brain injuries.
So basically, we're just, what have you done so far today?
So I did the banner on my head with some devices.
Okay. So those are called Tesla coils. Tesla is not the Tesla that makes the cars. Tesla is the inventor.
Okay.
So they're actually magnetic coils, and what they're there is that you notice they're in different spots.
Yeah.
And what they do is they bring connectivity. So they probably put them here today, correct?
Yes.
And that's because what we're trying to do is there's a part of your brain called the insular cortex.
Yeah.
Not that you need to memorize that, but the insular cortex is a wonderful area. When we stimulate it, it helps to bring things back online. Okay. We started at the beginning here because that was your cerebellum, and that's like the motor that drives everything.
Yes.
That's why that's your balance center. So when you don't feel well and you go for a walk and do some exercise and you go, oh wow, I feel a lot less stressed. You've done nothing for the stress, but yet you feel better and you're not stressed out. The reason is that your brain from the cerebellum, as you fire it, it goes into the brain, and that's the motor, that's the engine. So we start there, and now we're going to other parts based on your report that we did. Okay, that's kind of how we did it.
Awesome.
Yeah.
I'm really excited about this.
Yeah. So I'm going to do.
So what is this? What is this?
So everything I do, the way I look at it is anytime I want to work on your spine, I want to warm it up.
Okay.
So I have 3 tools that help to warm up your tissue. This one is for the muscle.
Okay.
So this one is just a generalized muscle tone. Then I'm going to use one for a deeper one for the deep tissues like the ligaments and the discs, and then I'm going to use one for your bones.
Okay.
When I cover all 3 of those tissues, it's pretty much everything that your spine's made of. Okay. We'll start with the muscles. This obviously feels really nice.
Yeah.
And everything's about blood flow and oxygenation to the injured areas.
Okay.
Because anytime you have like a car accident or fall and you hurt your spine, the muscles get injured, the joints, the ligaments. So this just helps to kind of, for us, just gets it all relaxed. The next one is, this is a modified jigsaw because it's the only thing that goes deep enough.
Yeah.
Now there's a whole bunch of knockoffs. If you go on the internet now, there's a whole bunch of knockoffs on this where they have that. Dr. Pettibon came up with this wonderful idea and patented it. He was my mentor, but he didn't patent it properly, and so people were allowed to take his idea and make a lot of money on it.
Yeah.
So, but it doesn't matter because the idea is that this kind of up and down is better for you. So this is for the ligaments and the discs and all the tissues deep down.
Yeah.
And because it works so fast, it's a lot easier. Okay? It doesn't hurt. Like, when you get somebody's digging in on your muscles, you're wow.
Yeah,
so
I didn't feel that. It's very light.
Yeah, because it works. And then the last one I think is this is like tapping on a jar. We can actually use this to adjust people, put the bones back in position, get them moving again. Not that they get out of position, but it's a good way to do it. In our clinic, we actually do restore the curves and fix posture. Yeah. So it's a little different than some of the other treatments.
I notice that my body feels calm.
Yeah. Well, as you take the pressure off the nervous system, it will sort of reset itself in a more normal level, and that's typically not as involved. Right?
Can I stay here with you forever?
You have to feed me and let me out every once in a while. But that's good. So this is coming along. This is nowhere near as tight.
Yeah.
I mean, is it fixed? Of course not. But comparatively to how long you've been here and how long you've had it, this is a very good. I would say we've made some nice progress in a short period of time, which is what we want to see.
Yes.
And then we marry that with the homework and the exercises, and away we go.
Dr. Horseman, what is the insular cortex and why is it important to stimulate the insular cortex?
Well, the insular cortex is an area of the brain. It's a very exciting area. A lot of information comes in. It's kind of like a connection hub. So it's like Grand Central Station. Sensations come in, and it helps the brain to sort of figure out what you're going to do with the sensations, what to think about it. So it's cognition, emotionality. There's a lot going on there. So we like to work with that area because it has a big impact on the entire brain.
So a person with a disability often know what cognitive impairments mean. I want you as a professional to explain to us, what is cognitive impairments?
Well, cognitive impairment, of course, there's various levels of it. And of course, there's different parts of cognition. But in general, it's just the inability to, I would first say, let's talk about memory. Short-term memories is one of the main things. So I can't recall what you just told me. Therefore, it's hard to have a conversation. It's hard to be in your workplace when you can't remember what somebody just told you or what somebody's name is. I remember when I first got injured, I had troubles remembering people's names. I know their faces. I've known them for years. And yet I'm sitting there looking at them going, I can't remember their name. It was very embarrassing. So when you get in that situation, you almost want to kind of not be out in public. It makes you want to, take yourself out of those situations. It's very scary as well. Also, just being able to put things in order. Like, I'm going to go to the store and I'm going to drive there. I'm going to, make sure I bring the bag. I'm going to, these are the things I'm going to buy there. And then I've got to stop and get some gas. And then when I'm at the gas station, I should pick something else up. Normally, you would just be like, I can bang all those things off. I don't have to put a lot of effort. But when you get injured, all of a sudden, those simple things, those little tasks become more of a problem, and you'll get to places and forget why you're even there. And it's very frustrating. So you got to learn to write things down, put lists up, simple brain functions that you take for granted every single day. And of course, the more injured you are, the more impairment you have.
Does everyone have the same cognitive impairments from brain injury?
No, it's very different. And again, what part of your brain was injured? So when you get a certain injury, let's say you're hit at the back of the head versus the front of the head or the side, was your neck involved in the injury? Did you have previous injuries before? All of those things will impact what part of your brain is going to be a problem. The cognitive area is the upper brain, the bigger brain, the newer brain. So we have one brain that's sort of connected to more primitive things, eating, digestion, breathing, heartbeat, all the things that we do. And then as we go higher up, we go to more coordination, and then we move to things where thought processes and things. So when you're talking about cognition, you're talking about 10% of what the brain does on a regular basis. Do you know the brain spends most of its time standing you upright, balancing you, and you can be able to move and walk. So that's why we spend the first part of the treatments focusing on that over the cognitive brain, and we get there after.
What role does one's vision play when someone has a brain injury?
Well, first off, this is a great question. The one thing I want people to understand is that you'll often go to your optometrist and they'll say that your vision's fine, okay? And you have no problem, you're still 20/20. But the people who've had a brain injury know that's not true. There's still a problem with their vision. And what we found is that it's actually the eye movements. You see, your eyes are right and left eye have to move together as a team. And what happens often with the brain injury is one eye stops behaving properly because the information coming in isn't the same as the other eye. And then your brain starts to have real difficulty because you start seeing two things. If I'm looking at you here and I'm looking at two of you, what it will often do is just ignore one. And then what happens is they don't move together as a team. And that dysregulation causes all sorts of havoc. Your depth perception's gone, so you're more likely to fall, or you can't read, or when you're driving, you feel very nauseous. And that's because you see your brains don't work together as a team anymore. That's one of the very first things we work on.
So I want to know about, a lot of people like the first word, Tesla. Can you use Tesla coils to treat other conditions?
Sure. Well, Tesla coils, that you'll see in the video, they are basically small electric magnetic fields that are created. They're very, very gentle. We don't need to have you anesthetized for it. But they stimulate the brain in a wonderful area. And what they really do, which is I love, is something called coherence. And what another fancy way of saying that is it's connectivity. It helps your brain to start connecting itself between, so we can put like two coils here and here, and it lets that brain start firing that pattern again. So we can use it for that. We can actually use it on your back if you want. You can use it for muscles. It was one of those things that was developed by the scientist, the Tesla, not not the car, not the electric car guy, but Tesla was a scientist and developed a whole bunch of magnetic therapies and energy thoughts and healing. And I believe humbly that we're going to be moving more and more to that in the future, because I'm seeing a lot of great research coming out on it.
Mm-hmm. How helpful is cold laser therapy with regards to treating brain injuries?
Well, it's great. A lot of the therapies out there are basically to bring blood flow into the area. Cold laser is just another one that does that. Great thing about laser is we can put it right on the back of your head, on your skull, on your muscles, and it helps the brain it gives you energies and it causes blood flow into the area. That brings oxygen and gets rid of waste products. So it just makes things work a lot better.
Behind every leader, there is a great team. Tell us about your team and what expertise do they bring to the table? And I want to hear, who is Linda One?
Well, Linda One she's the manager. She's my bride as well. We've been married for 10 years now. And she's basically makes sure everything gets run properly, that people are scheduled properly. We have a lot of people that are coming from longer distances because we're very specialized. So we make sure that they have the proper time. And then I have a great team. I have a Kyle, which is a kinesiologist, and he's been my right hand in the front back part of the clinic. And they've all been to a lot of the seminars that we've done a lot of extra training together as a team. I've trained them as well. So it's been great.
What's one advice you can give to a family member to help them help their loved ones going through a brain injury?
Well, I can speak from experience here. When you get injured, a lot of times you get very frustrated. You're not frustrated at the person, but you'll sometimes take out your anger on the people very closest to you. So the first thing I would say is just don't take things as personally once somebody's had an injury. Give them some space and try to understand where they're coming from. That would be the best. Give them as much support as you can. And it is very difficult when they're telling you they're having troubles going to places, or they don't want to go to a social setting. It's because maybe they're embarrassed, or it's difficult for them to handle it. So just be as supportive as you can.
Yeah, and it's so important to ensure that you be understanding and help support your loved one who's dealing with a brain injury, because it's not easy. That's all the time we have for today's episode of Health 180 with Carrie and Fan and Rogers TV and podcast. My name is Carrie and Fan. Thank you to Dr. Ian Horseman from the Brain Injury Clinic for joining us. Thank you to Susie Sher Oshawa, and thank you for joining us. And remember, together we're stronger.